Hello, thanks for joining us. Doctors' leaders have warned today that some parts of the North East are now facing a worrying shortage, where there are not enough GPs to care for patients.
The Royal College of General Practitioners says many of its members are having to see more than 50 patients a day, and they're struggling with workload pressures. The government is aiming to recruit thousands of extra GPs by 2020, but numbers here are actually falling at the moment, with many GPs taking early retirement and not enough trainees coming through. Tom Sheldrick reports.
It's a big improvement.
Yeah, big improvement.
All right.
Yeah.
Leslie is not a GP, but she does a lot of their work now as an advanced nurse practitioner, diagnosing conditions and prescribing medication. It's because this surgery in Gateshead has been affected by a shortage of GPs.
Right.
What we're finding is actually recruitment is becoming more difficult because often trainees who used to stay with us once they're qualified are actually now choosing to become locums, or they're choosing to go abroad.
And why do you think that is?
Patients are coming to the practice with many more complex needs, and that complexity actually is challenging to manage without the right support.
In the North East and Cumbria, 17,000 more patients are registered with surgeries than last year, but there are now 36 fewer GPs working here, and only 3/4 of GP training places are currently taken, the lowest of any region. Doctors came together in Newcastle today to discuss the problems. Dr Lamb is a GP in Northumberland and represents others around the North East.
In some areas there aren't enough GPs, and yes, it is worrying, but the patients are safe. We are still providing fantastic care, but we're struggling to continue to do so, and we can't continue on this route. We need some more innovation and more investment in primary care.
The Department of Health and Social Care told us that GPs are a crucial part of the NHS, and it's committed to meeting its objective of recruiting an extra 5,000 GPs by 2020. It's recently expanded a scheme to encourage trainee GPs to work in areas of the country where it's typically difficult to recruit. A new medical school in Sunderland was also announced recently, but it will take a number of years before doctors qualify. The challenge then at surgeries like this one in Gateshead is trying to stop pressures impacting on patients.
I would imagine they would be stressed because the number of people that come in. But I've never really had to wait for an appointment. If I ring up, I basically get it within a few days.
The pharmacies, walk-in centres, things like that, I think they need to put a bit more money into that to take the strain off the GPs.
Right now, the stark warning is that doctors' workloads are unsustainable. Tom Sheldrick, ITV News.